Imagine how helpless it might feel to watch someone you love suffer. Pictured is my husband, who was stabilized and transferred to a level 1 trauma unit after a severe dirt biking accident. His body was broken, fractured ribs, shattered ankles, collapsed lung, broken vertebrae, internal bleeding, and then, just to spice things up a little bit, he developed blood clots in his lungs on day 3 of his admission. Despite all this, it was his unrelenting pain that proved hardest to manage. Traditional options were either ineffective or contraindicated. Then came intravenous lidocaine, and for the first time, we saw relief. That moment sparked a curiosity and guided my research into IV lidocaine use. In Canada, trauma hospitalizes nearly 200,000 people annually. Acute pain is nearly universal, but opioids, the current first-line treatment, come with serious side effects: respiratory depression, delirium, dependence. Poor pain control is linked to worse outcomes like pneumonia and prolonged hospitalization. Yet, alternatives like IV lidocaine, though promising, are rarely used in regional settings. This gap became the focus of my research, ultimately leading me to ask, in adult trauma patients experiencing acute pain, does IV lidocaine lead to better pain control? To answer this question, I conducted a systematic search using databases such as CINAHL, PubMed, and Cochrane Library. I identified 12 relevant studies, 4 of which were critically appraised for quality and reliability. These included randomized control trials and cohort studies examining IV lidocaine's effectiveness and safety. The evidence shows that IV lidocaine significantly reduces pain, especially during movement, and lowers opioid use in some patients. It is safe, well tolerated, and effective for rib and limb trauma. Yet its use remains limited, often confined to ICU settings or tertiary hospitals. Barriers like staff familiarity, unclear protocols, and lack of education persist, particularly in regional hospitals such as Medicine Hat Regional Hospital, where I work. To bridge this gap, I created an educational intervention, a comprehensive information package for Medicine Hat Regional Hospital staff. It includes evidence-based summaries, quick review guides, protocols, and monitoring tools. Developed using the Knowledge to Action framework and ADAPT frameworks, the policy aims to raise awareness, reduce implementation barriers, and align with Alberta Health Services' vision for patient-centered, evidence-informed care. This research matters because it transforms lived experiences into actionable change. Trauma patients in regional settings should not be limited or suffer due to their postal code. They should be offered the same options as those admitted to tertiary centers. By educating clinicians about IV lidocaine, we can reduce opioid reliance, improve pain outcomes, and support safer recovery for trauma patients. My husband's story is not unique, but our response can be. Thank you.